Yeah, our program here is run in conjunction with a clinic in the Ukraine, but all of the visits would be to the SIMS clinic in Dublin. So typically patients would initially complete some forms for us online, and then we would arrange an initial consultation for them with one of our doctors. The doctors would go through a full consult, going through their medical history and making sure that they're suitable for the program. After that consultation, then they would sit with myself or Kathleen, my colleague, to go through the full ins and outs of the program, all of the investigations required, and to make sure that the couple are completely comfortable with everything that's happening. After that initial consultation, we can start taking some bloods to organise getting going on the screening process, and then we work on organising the male side of things, getting his sperm tested and organising a sperm freeze to send sperm out to the Ukraine. After the sperm shipment, then the couple would do donor selection, which they do online at home. We give them 2 days access to a secure website where they can look through all of the donors available at that time to choose a donor that suits them best. And then there's a little bit of a quiet phase then where the donor is undergoing an IVF process in the Ukraine. The sperm is sent out along that phase to the Ukraine. She has her egg collection. Eggs are fertilised with the male sperm. Embryos created and frozen and brought back to Dublin for transfer. And it's at that stage then that we start organising the female partner for an embryo transfer. Her tests and scans can be done locally, and she would just need to come back to Dublin then for her embryo transfer procedure. All that would be required is the initial consultation, where we can plan to do a lot of work on one day, and there would need to be a second appointment for the sperm freeze and a third appointment for embryo transfer, and we can really fit in a lot of things on the days that you're here, and anything else can be done with your local reproductive centre. We can organise transport from them from the airport, and we can also give them recommendations of hotels that are nearby to make sure that their trip is as painless as possible.
Because I know some people sort of worry about that if you're going to Spain or Greece, you have to go, it's like a 10-day holiday, and that's quite a commitment. Whereas I think, coming here, it's more manageable.
Well, if for people coming from the UK, it is certainly, because it's a much shorter flight. There's no language barrier. It is definitely an awful lot more manageable, able to get last-minute flights at quite a reasonable price. And we're not far from the airport either. It's only really a 40-minute drive from the airport. So it is quite easy to manage for people, and we would regularly have people travelling over in the morning for a whole load of tests and investigations and travelling back that evening, or equally for their sperm freeze, coming over and back the same day. When people are coming home for their embryo transfer, we recommend they stay a night just so that they can relax after their embryo transfer and take it easy, take it at their leisure.